What are the applications of genetic testing? This slide summarizes some of the main ways that we use genetic testing. Carrier detection for recessive genetic diseases. Maybe you're working with a family in which cystic fibrosis is being inherited. Perhaps there is a normal person in that family, but that normal person does not know whether she is homozygous normal or a heterozygous carrier for cystic fibrosis. Maybe she wants to have children and wants to know about the risk of her children developing the disease. Well, we can do genetic testing to determine whether or not she is a carrier for the disease so that we can counsel her about the risk to her children. Diagnosis for late onset diseases. For example, Huntington's disease. Perhaps a person comes into your office worried that he will inherit Huntington's disease because he knows that that disease is being inherited in his family. Perhaps that patient is only 20 years old. Well, you have two choices. You can either wait another 20 years to see if the symptoms develop, or you can do a DNA test and determine very quickly whether or not that patient has inherited the mutation for Huntington's disease. Now, unfortunately, if the patient has inherited the mutation, you cannot do anything about preventing the onset of the symptoms, but you can help to prepare the patient for what is coming to him in the future, and you can also counsel him about the risk to his children. Diagnosis for diseases with incomplete penetrance. Perhaps you're working with a family in which retinoblastoma is being inherited. Maybe there is a normal person in that family. That normal individual does not know whether he is homozygous normal or whether he has inherited that mutation and is one of the lucky 10% that never acquired the secondary mutation and did not go on to develop the disease. Well, with genetic testing, you could determine whether or not he carries the mutation to, again, counsel him about the risk to children that he might have. We can do prenatal diagnosis for genetic diseases by getting samples of fetal DNA, usually either by amniocentesis or chorionic villus sampling. So by such DNA tests, we are no longer bound by making those probability predictions that we talked about earlier in this series. That is, we are no longer bound by telling parents that your child has a 25% chance of developing cystic fibrosis. By doing DNA testing, we can determine exactly what the risk. With essentially 100% accuracy, we can determine exactly what the baby will be, whether the baby will have the disease or not, or will be a carrier or not. The last application here is a relatively new one involving pre-implantation diagnosis. This is a relatively new technique that is most commonly used if we have a situation where we have a set of parents that are both known to be carriers for some devastating genetic disease. In this case, what we do is in vitro fertilization, and we allow those early embryos to begin developing. We allow the embryos to begin developing to the 8-cell stage. And at that 8-cell stage, we go in and remove one single cell from each of those early embryos. And then we can use PCR to do DNA testing on the DNA from that one single cell. PCR is so sensitive and so accurate that we can do such DNA testing on the DNA from one cell, and then what we do is identify which embryos are destined to develop into normal children, and then only those normal embryos are implanted back into the mother to essentially guarantee that this couple will have a normal child. In this chapter, we looked at direct genetic testing and indirect genetic testing. We looked at the basic characteristics of those two different kinds of testing, and we looked at a number of examples of each type. And we have seen some of the applications of how we could apply these tests to certain genetic diseases.